Did you know that 1 in 1000 people suffer from primary immunodeficiency diseases, widely known as PIDs? However, a large majority of them remain undiagnosed because of the lack of awareness. Many people in India, adults and kids, are not aware that they have PID, because of which they are not getting the right treatment at right time. And the good news here is that PIDs can be cured with the right diagnosis and the right treatment. April 22nd to the April 29th, we are celebrating PID Awareness Week. And on this occasion, we are having this wonderful podcast on this amazing topic. Hello, hi, namaste. My name is Hema and I am your host for today's podcast. And to discuss on PID, we have a very special person to discuss this very interesting topic. And today, here with us, we have Dr. Ankur Kumar Jindal, who is a senior consultant in pediatric clinical immunology and rheumatology at Manipal Hospitals, Bangalore, a former associate professor of pediatric clinical immunology and rheumatology at PGI Chandigarh, who has just recently shifted to Bangalore. So, sir, a very warm welcome to Bangalore and for this podcast, and thank you so much for giving your valuable time with us.
Um, Thank you so much for inviting me and for giving me the opportunity to be participating in this very interesting podcast on primary immunodeficiency diseases. Thank you so much.
Thank you, sir. So, before we dive into this very interesting topics of PIDs, I would like to know how do you feel about Bangalore?
Bangalore, I'm finding it very, very interesting, and more importantly, Bangalore is treating me well, so I'm liking it. Yeah.
Awesome, awesome. That's nice to know. So, sir, I would like to know what are primary immunodeficiency disorders and who can be affected by this?
To understand primary immunodeficiency diseases, we need to understand how our immune system works. We are born with an immune system which is a complex system in our body, but also a very well organized system. Which comprises of many cells in our body. So this immune system uh, keeps us away from infections. It protects us from infections and many other diseases that an individual can acquire. Any defect in this immune system, which is mostly uh, present at birth, which is mostly inherited, it is caused by one or more of the genetic problems, can lead to disruption in one or the other arms of the immune system. And these individuals who are born with this defect in the immune system are predisposed to various infections as well as some several other problems. So these diseases, wherein an individual is born with a defective immune system, are known as primary immunodeficiency diseases.
All right. So, how common is PID in India, and how can one be aware that they are affected by PID? Because not many people know what PIDs are. So, how can one detect that their child or they themselves have PID?
Mhm. Well, this is a very important question, and I would say there is a remarkable lack of awareness about PIDs, not only amongst the layman population but also amongst the healthcare practitioner. It is often believed that these diseases are rare, but these diseases are not. I mean, by definition, they are rare. But if you look at the size of population in our country, we are likely to have more than a million patients with the primary immunodeficiency diseases in India. However, if you look at the statistics, if you look at the data from various registries, from various hospitals, not more than a few thousand of these patients have been identified so far. So it clearly suggests these diseases are being missed, these diseases are not being recognized, and as a result, these patients who are not getting a proper diagnosis are definitely not getting a proper treatment, and this leads them, or this puts them at risk of several long term complications as well as mortality at times.
Okay, so how does one detect this at early stages, and
Mhm.
what are the long term complications which you're referring to?
So, as I said in the beginning, our immune system protects us from infections,
Right.
and defect in the immune system can predispose an individual to develop infections. How these patients present? They present with recurrent infections in most immunodeficiency diseases, starting from early childhood.
Mm-hmm.
They develop infections in the ear, they develop infections in the lungs, presenting as pneumonia. They present as infections in the GI tract, which we call it as diarrhea. They present
Okay.
with recurrent loose stools. They can develop infections in the skin. Some of these patients, because of these recurrent infections, do not thrive well, and they have low weight, and their growth is impaired. And
Right.
at times, these infections can be even more severe, and they can affect your brain as well. So I think the most important message for early identification of these diseases is an early suspicion. So
Mm-hmm.
whenever a patient is falling sick again and again because of infections, is requiring hospitalization because of these infections, requiring intravenous antimicrobials for treatment of these infections. Antimicrobials are basically antibiotics.
Right.
So, if a patient is requiring intravenous antibiotics to treat these infections are taking longer than usual time to clear.
Mm-hmm.
I mean, that is a time when a parent should think of seeking help from an immunologist, and should get the child evaluated for an immunodeficiency disease.
All right. So you just mentioned about various symptoms like loose stools,
Mhm,
pain in the ear, or infection in the lungs.
mhm.
So how long can this prevail in one?
So it depends. There are several types of immunodeficiency diseases, and each immunodeficiency disease can predispose to individual group of infections or group of manifestations.
Mm-hmm.
Uh, Pneumonia in these patients can sometimes persist for several months, and so is diarrhea. Sometimes these patients have recurrent episodes of diarrhea going on for several months,
Mm-hmm.
uh, unrecognized, because of a lack of awareness on parts of the parents and sometimes the healthcare practitioners. So these infections can go on for several months, 2 years as well.
Okay. So what are the different types of PID?
Mhm. There are, the recent medical literature suggests that there are more than 500 different types of primary immunodeficiency diseases that have been described in the world, and they affect different parts of the immune system. There are various cells of immune system. We call we you know These are basically the medical terms. We
Mm-hmm.
call them with various names, such as T cell, B cell, and many other cells of the immune system. And defect in any of these cells lead to a different type of immune deficiency and a different spectrum of clinical manifestations.
Okay. So thank you so much for giving these insights, doctor. But I have a question or two. You just mentioned that there are 500 different types of
Mhm.
PID. So in these 500, so how does one identify that this is because of PID? Like we mentioned earlier, ear pain or infection in lung. Probably they might go to an ENT
Mhm.
or probably a pediatric,
Right.
and they might get medications or probably medicines prescribed for that particular pain relief, which would be temporary probably, but how do they address the core problem of this?
Well, that's a very important question, and that is right now, the main existing problem when we talk about primary immunodeficiency diseases in India. If you have a ear infection, you will of course go to an ENT.
Of course.
If you have a pneumonia, you'll go to a pulmonology. If you have a diarrhea, you will go to a gastroenterology. If you have a skin infection, you go to a dermatology. And I think this is a quote that we often talk about when we talk about primary immunodeficiency diseases: do not miss the forest for the trees. you know uh, each of these manifestation are trees, but do not miss the forest. I mean, you have to look at the bigger picture, and somebody has to recognize that one individual having so many manifestations, affecting the lungs, affecting the gastrointestinal tract, affecting the skin, affecting the ears, So somebody has to recognize this pattern and think of immunodeficiency diseases and do investigation for immunodeficiency. Yeah.
Okay, so with the right investigation and the right help, can this be cured?
Uh, I mean, yes, there are, you know, several advances in management of primary immunodeficiency diseases that have evolved over last 2 decades.
Mm-hmm.
Uh, I think in if adequately diagnosed well in time, it is possible to cure many of the primary immunodeficiency diseases at this point of time. For a few of the primary immunodeficiency diseases, these patients need long-term treatment sometime for their life.
Mm-hmm.
However, these treatment options are now available in our country, and these can easily be accessed by a patient through various support systems that are available in the country at present. So, I would say that I think the most important challenge for us right now is the identification of primary immunodeficiency diseases. Once identified, I think we have enough resources available at this point of time to treat and to give better life to these patients.
Of course, that sounds like a very nice option so that they can lead healthy lives as well.
Yes.
Now, I would like to understand, doctor. So, once PID has been recognized and we give the right kind of treatment to the patient, so let us say out of 100, what is the success ratio of the person or let's say the child to get completely rid of PID?
Um, I would say, I think, once again,
It depends
highlighting,
on various
yeah, various
factors, but on
factors.
an average,
Hmm.
let's say on a general note,
Hmm.
since you're the expert over here, I'm sure you would have seen a lot of such situations in your career.
Right.
So, can we know on how one can diagnose this, and if any common man, or let us say a family person, or let's say a child from a middle class community can afford these services?
Yes, I think this is something which I would again want to highlight and stress upon. The biggest challenge is identification,
Right.
and the biggest challenge is identification on time. If you can identify these diseases well in time, when these patients have not developed complications that we cannot manage. So some of the complications like permanent damage to the lungs, which may be difficult to manage.
Yes.
So at this point of time, I do not think there is any immunodeficiency diseases for which we do not have a cure. So we have cure for all primary immunodeficiency diseases that we know of, and early identification and development of complications and providing treatment to these patients before these patients develop complications is the key.
Okay.
Mhm.
So, since we have different types of PID and before it leads to complication, now let us say we have an infant or a little toddler
Mhm.
and the parent is not aware that he or she has PID, but and they have grown into an adult, but the little one often keeps falling sick. So, can there be a possibility of it being genetical?
Yeah, so most of the primary immunodeficiency diseases, I would say most, not 100%, are caused by one or the other form of genetic defects. And that's why, when we diagnose primary immunodeficiency diseases, we always do a genetic test to confirm the diagnosis of a primary immunodeficiency disease. So whenever a patient reaches a healthcare practitioner, and whenever evaluation is being done for primary immunodeficiency disease, there is always a need to do genetic tests to diagnose most of these genetic disorders. So yes, most of these these primary immunodeficiency diseases are genetic in origin.
So, most of them are genetic.
Yes. Mhm.
So now, like I mentioned earlier, the parent has suffered from PID for quite a while, and now the little one is into their life. So, as a newborn, the parent would definitely get a lot of tests and lots of checkups for their little one.
Mhm.
So, during this process, if they get the little one tested for PID, is there a chance for the parent to know that their little one is affected with PID? And can the diagnosis start at an early age so that the child doesn't suffer in the future?
Okay, so I think it's very important to understand that parents may or may not be affected by a PID. but the child can be affected with a PID. So it is not necessary that
It should be from the
parents
parent
have
through
the disease
genetical. Yes.
and then it is being transmitted to the child. So there are various patterns of transmission in PIDs, and for that matter in any genetic disorder that we talk about. And most primary immunodeficiency diseases, in most of these diseases that we talk about, parents are healthy,
Wow.
and they may act as a carrier. That's a different situation. So this is something that we talk about when we are counseling a family with primary immunodeficiency diseases, how it affects the risk of having the same disease in the next pregnancy when they are planning a next pregnancy. So if a child is born with a primary immunodeficiency disease, that's the next step that we do. We counsel a family about the risk of having a same disease in the next child if they are planning a pregnancy. But as I said, in most cases parents are not affected with the disease. They are healthy just like you and me, but the child is affected with the disease.
Okay. So, Dr. Ankur, who can be affected by PID?
Uh, so, as I said, this is a genetic disorder, and a genetic disorder can affect anybody. And because it is a genetic disorder, it starts from birth. Most often, this disease is seen in children. Depending on the type of primary immunodeficiency disease, symptoms may start in the first year of life, most often, but
Oh,
not always. Symptom may start at the age of 5 years, at the age of 10 years, and there are several examples of primary immunodeficiency diseases wherein the symptoms for the first time start when an individual is an adult. So it might be a myth that because this is a genetic disorder, so the symptoms will always start in the childhood. It's true that most patients will become symptomatic in the childhood, but it is also possible that the symptoms may start in adulthood as well,
oh,
and adults may
okay.
also be affected with primary immunodeficiency diseases. And as I said, it's a genetic disorder. All population, anybody can be affected with primary immunodeficiency diseases, but there are certain populations which are more predisposed to develop primary immunodeficiency diseases, such as communities wherein there are lot of consanguinity. So consanguinity, with consanguinity I mean wherein there are marriages within the same family, because these are genetic diseases. Those families wherein there is consanguinity, those families are at more risk of developing primary immunodeficiency diseases.
All right. So, if this is the case, you just mentioned that they can also develop it as adults and not
Mhm,
just as children.
mhm.
So, can we know more about the diagnosis part of how one can be diagnosed with PID?
Okay, so that's very important. So there are, I mean, the first and foremost thing is, as a clinician, as a doctor, we want to know the detailed history of a patient and a detailed family history as well. Sometimes just by looking at the type of infection that a patient is having, the type of family history that a patient has, if there is another affected individual in the family with the same disease, the type of organ system is that is getting affected in an individual. It is extremely important for us to take a detailed history on that line to understand what kind of primary immunodeficiency disease that we're dealing with. So once we do that part,
Mm-hmm.
then we do blood test in these
Okay.
patients. So whenever a parent or a patient comes to us for the evaluation of a PID, we do a blood test to
Okay.
understand which part of the immune system is affected. So, we call them tests such as serum immunoglobulin levels. We also look at the cells, as I mentioned in the beginning, about T cells, B cells, and there are a lot of such tests which are done. And the type of tests that we do also depends on what was our assessment on history of a patient, and then accordingly we do these blood tests in an individual to diagnose PIDs.
All right. So you just mentioned the few blood tests
Mhm,
on what are the tests one can take to know if they are affected by PID or
mhm.
not. But are there any specific centers where one can get these tests done, or is it available in any hospital in the city?
So that's a very important question. Uh, test for diagnosing PIDs may not be available at all centers because these are slightly specialized tests, I would say. But fortunately, and that's a I would say that's a very good news for parents in the community that there are several centers that have come up in last 1 decade
Wow.
across the country. There are several trained physicians now across the country who have been able to set up an immunology unit or an immunology department in various hospitals across the country who can do these diagnostic tests for PIDs and diagnose these patients. So one has to really seek help from a specialist who understand primary immunodeficiency diseases, who can order these tests, and also when a physician get these reports, can also understand the meaning of normal and abnormal reports. So these tests are available in most large cities. So for
Mm-hmm.
example, Bangalore, if we talk about Bangalore has a few centers, like for example where I work in Manipal Hospital, we have a good availability of diagnostic facilities for all kinds of primary immunodeficiency diseases. Mumbai has centers for primary immunodeficiency diseases. Delhi has, Chandigarh has. So uh, wherever a patient is, they have to find out availability of diagnostic facilities in their particular city or region, and they can approach that particular center or a physician. It's also important, as I mentioned in the beginning, many of these diagnostic tests involve genetic diagnosis. And fortunately, we have genetic diagnostic facilities in many parts of the country now,
Wow.
and they are very very affordable, at a very affordable cost for parents, unlike many European countries or United States, wherein the availability of genetic test, I mean, I won't say availability, but the cost of genetic test in India is much cheaper as compared to many other so-called developed countries. So so we are very fortunate to have availability of these diagnostic facilities at an affordable cost, and I think this is something that must be used more often whenever there is a suspicion of a primary immunodeficiency disease.
Wow, that's very interesting and
Mhm,
very nice to know that we have places where people can also afford it. But, doctor, I have a few questions
mhm,
here. You mentioned about the few tests earlier, so I would like to know if there are different tests for children and different tests for adults.
mhm.
And coming back to these centers, when we go to these centers saying that yes, we want a report for all of these, can a middle class family afford these tests?
It's a very important question. So yes, these tests, as I said, are reasonably affordable
Mm-hmm.
for most of the families. So at some of the centers, and under some scheme or some insurance or some of the policies, these
Mm-hmm.
tests can be done at a very reasonable cost, which
Wow.
can be affordable for most of the patients. So to the best of my knowledge and to the best of my experience in managing diagnosing and managing these disorders, cost has not really been a major factor in diagnosing most primary immunodeficiency diseases. I think the major challenge for us has been awareness, and if a patient can reach out to a physician for diagnosis, for understanding the diagnosis of their PIDs, I think cost has almost never been a challenge in diagnosing these PIDs. And to your question on, are there any differences between diagnostic facilities for children and adults? So that's not I mean, there is no real difference in how we diagnose children and how we diagnose adults. The spectrum of diseases can be slightly different as we see in children as compared to what we see in adults.
Mm-hmm.
And as I said, depending on the clinical symptoms of a patient, we advise test.
Right.
And that's why, by looking at the symptoms, just by looking at the entire history of a patient, we decide what tests need to be done. But the diagnostic facilities in children and adults are not very different.
All
Mhm.
right. So thanks a lot, doctor, for giving me the insight on this. I also have another question to ask you. So we just heard earlier saying that we have more than 500 different types of PID.
Mhm.
So we have different types of PID, but do we have enough physicians in the country, or let's say in the city, to address this?
Yeah, I think it's again a very important question, and I think for parents or for patients who are listening to this podcast, I think they would want to know: do we have enough physicians who can take care of us? Of course, that's the if I'm a patient, I would want to know if there is somebody out in the community who can
Of
take care of
course.
me. So. Fortunately, again, we have many physicians now who can take care of primary immunodeficiency, and they are spread all across the country.
Mm-hmm.
You talk about any state in the country, they are there. They are not many in number, so you cannot expect a small hospital or a small healthcare facility to have an expert on diagnosis of primary immunodeficiency diseases or management of PIDs.
Mm-hmm.
So you have to reach out to a specialist center, and but fortunately these centers are now available in most large cities, such as I mentioned, we have one such center in Manipal Hospital, Bangalore. There are a few more centers like this in Bangalore, and in most cities they are available. Um, Many of the information related to healthcare physicians who are expert in PIDs are available on website as well.
Mm-hmm.
So if at all somebody has to seek some information on Google, they should not seek information about their symptoms. They should actually be seeking information about a healthcare physician who can
Of
understand their
course.
symptoms. So that's actually a very important message that should go through across the community.
Sure.
That please look for a physician. Do not try to ask Google about solution for their problems, but try to look for a healthcare physician who can understand your symptom and who can answer all your questions.
Right, very true. I'm sure with Google, very handy these days.
Mhm.
People just Google any question, or we have AI as well who will just answer the questions within seconds.
Mhm.
So, now speaking of the diagnosis part and people Googling this, once they get to know that they are diagnosed with PID, they might also look for answers on how long it might take,
Mhm.
or various other questions like what are the long term symptoms. So, my question to you is, how long? I understand there are different types of PIDs, but on an average, how long can it take to diagnose from a physician point of view?
Um, that's a slightly unfortunate part in India at present. I mean, we have seen cases wherein the delay in diagnosis has been as high as 20, 30 years. So a patient has
Oh
been
my god.
suffering with the symptoms for 20, 30 years, and before they reach a diagnosis. But I would say that with improvement in the awareness amongst physicians, and now we're doing these podcasts especially targeting general population, the layman. I think the awareness is gradually improving, and now these diseases are getting diagnosed relatively early in time. But as I said, I mean, we have seen remarkable delays in diagnosis of PIDs in the past.
Okay. So, what are the general options for diagnosis of PID?
So as I said, it is extremely important to get an early suspicion,
Mm-hmm.
reach out to the appropriate healthcare practitioner, and then a healthcare practitioner who specializes in PIDs will order test according to the symptoms,
Mm-hmm.
and that would also include genetic test, and then they'll try to interpret those results, and that's how we reach the diagnosis of a PID.
Okay.
Mm-hmm.
So you earlier mentioned that sometimes it has taken 20 to 30 years
Mm-hmm.
for a person to know that they have PID.
Mm-hmm.
So I know that sometimes they said it's never too late than never do it. So
Yeah.
in this situation, once the person is aware that they are affected with PID after 20 or 30 years of their life,
Mm-hmm.
so what is the option for them and what is the procedure for them? And I know every diagnosis and every treatment is different, but how long could that take on an average for them to be completely cured?
So I think we can talk about treatment in detail, but as I said in the beginning, that we have cure for many primary immunodeficiency diseases at present, whether diagnosed early. Uh, when their symptoms start,
Mm-hmm.
or when they start having symptoms, when they are diagnosed several years after their symptoms have started. But the outcome, of course, depends on how early we diagnose.
Right.
So a diagnosis that has been established within a few months of onset of symptoms
Mm-hmm.
would definitely give you a better outcome as compared to a diagnosis that has been established a few years after the onset of the symptoms. But the treatment options would remain the same.
Mm-hmm.
For many primary immunodeficiency diseases, as I mentioned, we have a cure. For
Mm-hmm.
many, not many, but for a few, we do not have a potential cure at present, and these patients have to be on a long-term treatment. But with that
Okay.
long-term treatment, these patients do really well. They have a good quality of life. We have patients who started having symptoms in the childhood, were diagnosed in the childhood, now are there into third or fourth decade of life, leading a very good life. Some of them are doing a very good job. Some of them are having children now, and this just changes the outlook of a person
Mm-hmm.
if they have been diagnosed on time and they've been initiated on treatment on time.
Right.
Mhm.
So when you mentioned that some of them had recognized them early
Mhm.
and took the diagnosis early, and now they also have kids and doing well for themselves in their career.
Mhm.
So now, once if they get diagnosis and if they help themselves get cured before they have children, so is there a chance with the slightest possibility that even if they are completely cured, that genetically might pass on to their little one?
Yeah, I think that's a very important question, and that's a very important question that parents would want to ask a physician. I mean, there is no easy answer to this, and I think this is something that we always discuss with the parents
Mm-hmm.
whenever such situations arise. Depending on the type of PID that we have been talking about, there is a risk of transmission to the next generation, whether they've been cured or they have not been cured, or they are taking treatment or they're not taking treatment. So it's a very complex subject, and we need to talk to the parents depending on the type of primary immunodeficiency disease. What is the risk that their child can have a primary immunodeficiency, a PID of the kind that a parent has?
Mm-hmm.
And the risk can be somewhere between 50% to as high as 100% in some of these diseases.
Irrespective of the parent being cured, is it?
So it depends. I mean, the cure that we are talking about in many of these diseases is we call it as hematopoietic stem cell transplant or bone marrow transplant in many of the
Okay.
patients. Now, despite having received a bone marrow transplant, despite getting cured of the disease by bone marrow transplant, there still is a risk that the patient can transmit this disease to the next generation.
All right.
Yeah, so as I said, this is a very complex subject, and the decision to screen the baby before birth, and the way we counsel the parents depends on the type of immunodeficiency disease, depend on the type of treatment that the patient has received, and so many other factors are taken into account. And we always involve a genetic counselor into the counseling and assessment of risk of transmission to the next generation.
So you just mentioned about generic scanning. So if the child is not yet born, and
Mhm.
if it's still in the womb, so is there a chance that we could know if the child is affected by PID?
Oh yes, that's possible, and that's something which is being done right now in India in many centers. Especially, when I was in Chandigarh, we were doing this test very very often in parents. So the common situation is when we know that a child has been affected with a PID, we also know the genetic defect in that particular child, and we know that there is a risk of having a similar disease in the next child. We test the baby in the womb at approximately 3 months of the gestation age, or 3 months when the child is in the womb, and we in a couple of weeks after doing the test, we can tell the parents if the child is affected with the same disease or is not affected with the same disease. And at that point of time, parents often have to take a call, whether they want to continue pregnancy or they do not want to continue pregnancy if a child has been born, has been, if the baby is found to be affected with that particular disease. So this is an easily available, I won't say easily available, but this is a test which is available now at a few
Various
centers in the
centers.
country. And I think this is a facility that can be accessed by parents when they know that one child has been affected with a particular disease, and they do not want that this disease to be transmitted to the next pregnancy. I mean, this is something that can easily be done now in many parts of the country.
So, Dr. Ankur, what are the treatment options for PID, and how can one access these treatment options?
Right. Once we diagnose a patient to have a primary immunodeficiency disease, there are several treatment options now available for these patients. Uh, First and foremost is, when these patients are diagnosed at that point of time, we tend to give them antibiotics, because most of these patients at that point of time have infections, and the general key is that we have to treat their infections for a longer period of time as compared to treating an infection in a otherwise normal individual, because they don't have a very good immune system. And treating infections in these patients would mean a longer duration of use of antibiotics. So after treating an acute infection in patients with the PIDs, we put them on we start them on something called as antibiotic prophylaxis, which is a low dose of antibiotic that we give to these patients to prevent infection in these patients. Uh, and that antibiotic prophylaxis has to be used for a very very long duration. Now the choice of antibiotic depends on the type of PIDs that we've been dealing with. In addition, most patients with PIDs would require an immunoglobulin replacement therapy. This could be in the form of intravenous immunoglobulin replacement or a subcutaneous immunoglobulin replacement. And this is a form of therapy which is used in most patients with PIDs, and some patient would need it for a very, very long duration of time. Apart from this, we have several other treatment options. In the medical term, we call them as targeted therapies,
Mm-hmm.
and that depends on the type of manifestation that the patient has. This is something that we have not talked about so far,
Mm-hmm.
but patients with PIDs at times, apart from having infections, can also have something, in the medical term we call it as autoimmune diseases, wherein your immune system is not only deficient but is behaving abnormally and is trying to attack your own body organs, such as your joints, wherein you can develop arthritis. Sometimes your blood cells, like hemoglobin, can lead to anemia or low hemoglobin, and sometimes can also affect other parts of the body, and can lead to autoimmune manifestation. Now, why it is important to know for anybody who has a PID, because at times to treat these other manifestations like autoimmune manifestation, we have to use some drugs. We call them as immunosuppressants or
Mm-hmm.
steroids sometimes, and there are some other drugs in the category of steroids that we have to use for these autoimmune manifestations as well.
All right. So, Dr. Ankur, can you please help us in understanding how does immunoglobulin therapy help in managing PIDs and how one can have access to this?
Okay, so I would say that immunoglobulin replacement therapy is the backbone of treatment for most PIDs.
Okay.
Uh, we in PIDs, most PIDs will have deficiency of something called as immunoglobulins. Now
Mm-hmm.
there are different types of immunoglobulins in our blood. We call them IgG, IgA, IgM, and IgE. What intravenous immunoglobulin contains, it contains a very purified form of IgG, which has been extracted from the bloods of normal individuals, and that IgG, when given to a patient with PID, replaces the deficient IgG that is there in the blood of a patient with PID. So it's a replacement therapy for something which is deficient in their blood, IgG molecule. We replace them with this immunoglobulin therapy. Now, it's very important for everybody to understand that there is a life of IgG in the blood. So,
Mm-hmm.
when we give IVIG to a patient, the IgG would disappear in 3 to 4 weeks, and then we will have to repeat the dose of IVIG to that patient so that their level of IgG continues to maintain in the blood. So this is a form of therapy which in some patients can be lifelong. So some diseases which we call as antibody deficiency, these are again medical terms, something like X-linked A gamma globulinemia or common variable immunodeficiency. These are some of the diseases wherein immunoglobulin replacement or IVIG is usually a lifelong therapy.
Mm-hmm.
Now, for patients, it may become, they may find it extremely uncomfortable, or they may feel how can one access such treatment options going on for their life. So I would want to highlight that now these some of these drugs, especially intravenous immunoglobulin, is being covered under many schemes, and
Okay.
especially over here I would like to talk about the national rare disease policy of the government of India.
Okay.
And this policy is in existence for more than 3 years now,
Wow.
and there are several centers across the country. So there are at least 12 centers, and there are many centers coming up. We call them as center of excellence for rare disease, and these centers can provide free of cost intravenous immunoglobulin and many other forms of treatment that we use for patients with PIDs.
Wow.
Mhm.
That's really nice to know, doctor. So now you just mentioned about people using this treatment sometimes for lifetime.
Mhm.
So are there any new treatments or therapies that would help a patient manage their PIDs?
Right, that's very important. Uh, and that's a question that many patients ask us. Is there any curative option for their PID? And I think this is very important to talk about curative options at present time.
Mm-hmm.
uh, so I would say that for many PIDs we have a curative option available,
Mm-hmm.
which we call it as hematopoietic stem cell transplant, or in a more layman term we call it as bone marrow transplant.
Okay.
Right, so it's different from a very commonly known kidney transplant or liver transplant. So this is a different procedure as compared to many other transplant.
Mm-hmm.
And now there are several centers in the country which offers bone marrow transplant for patient with PIDs. So when we talk to our patients with the available treatment options, now there are some PIDs wherein bone marrow transplant is the only option which is available, and we offer them right away. When they come to us, we diagnose a PID and we tell them, okay, bone marrow transplant is the most important option for treatment, or the only option for treatment at this point of time. And a
Based on the
patient,
intensity
based on the type of disease that we have been
type
dealing
of
with,
disease.
and we straight away talk about bone marrow transplant in those patients. Now there are certain conditions wherein we do not straight away talk about bone marrow transplant. We want to manage them with many other drugs or many other treatment options such as intravenous immunoglobulin.
Mm-hmm.
And when this doesn't work in those patients, that is the time when we talk about using bone marrow transplant as a treatment option in those patients. uh, there are treatment options like gene therapy coming up nowadays. Unfortunately, for India, that is still a dream because we do not have gene therapy available for many of these diseases in India so far. Gene therapy basically means because these are genetic disorders, so
Mm-hmm.
there is a defective gene. You
Right.
correct the gene. That
Oh,
that
wow.
that's how it is. And so this is something which is an upcoming treatment. Uh, Again, I mean, cost would be a factor that would play a major role when these treatment options come to India.
Mm-hmm.
But I think, yeah, this is something that parents or patients can know that this is an option which is available in the world.
Outside country.
Yeah, but I think in a few years down the line, I think we may be talking more about these treatment options. Uh, in addition, as I mentioned briefly about targeted treatment options, so wherein we know about a particular gene defect or a particular molecule which is defective in a particular patient, and then we give specific targeted treatment towards that particular uh, molecule or that particular defective protein. So these are some of the targeted treatment options that we offer to these patients. Again, many of these treatment options are in development, are not really in clinical use, or in, we are not offering this treatment to many of our patients with PID in India at present. But I think we have a bright future for these patients. Many of these treatment options will come up, and I think we will be able to offer to our patients. Mhm.
Awesome. So I hope those treatments come to India soon
Yes.
so that where we can correct the gene and ensure that this doesn't get on passed to the
Yeah.
next generation.
Mhm.
So doctor, now speaking of which, we you were just mentioning, so correcting gene is nothing but precaution so that we don't pass it on to the next generation. And as the saying goes, precaution is always better than cure.
Mhm.
So what are some precautions you would advise as a PID specialist to your patients in managing the PID?
All right. Just uh, adding to the gene therapy. So it is not only an option to prevent from going to the next generation. It is a cure for the disease. So you correct the gene and you behave like a normal individual. So it is a curative treatment for a patient, just like bone marrow transplant. In bone marrow transplant, we replace the abnormal cells with the normal cells from an individual, and that's how it works in a patient with PID. Uh, so, uh, as we've been talking about more definitive treatment options, I think it is also important for a patient or a parent who has been taking care of a patient with PID
Mm-hmm.
to understand the precautions, the general measures that they should be taking care of. And one of the most important message is hygiene, maintenance of hygiene.
Right.
So you have to understand, your immune system is not working. Uh, you know, if I get exposed to something, my immune system is working and will take care of that particular thing. On the other hand, a patient whose immune system is not working, if he or she is exposed to an environmental agent, like for example eating unhealthy food which has not been well cooked, his or her immune system will not be able to take care of the infectious organisms or infections present in that particular food, and they will get sick.
Right.
So it's very important to maintain hygiene,
Mm-hmm.
to have healthy food, boiled food, well cooked food, to use hand to have hand washing done before eating food,
Consumption of food.
consumption of food, and to also drink water which is either boiled, cooled, or with a filter. So in addition to hygiene, we also advise patients to avoid certain vaccination, because a vaccination which is so important for a general population to prevent against diseases can actually be counterproductive in some patients with PIDs. So it is important that you ask your expert which vaccines are going to work for you, which vaccines can actually be harmful for you, and you should avoid those vaccines to be used. So these are some of the general precautions that a patient should take care of. Mhm.
Right. So, thank you so much for giving us an insight
Mhm.
about these precautions. So, sometimes there are also chances that people might assume that these are myths
Mhm.
and probably follow their regular procedure.
Mhm.
But now, speaking of myths, I would like to understand one thing here, doctor. What would you tell or what would you advise to a patient who has various myths about PID?
Right. I think the most important myth that we've been living with in India is PIDs are rare, they cannot be diagnosed, they cannot be cured. So, over last several minutes, we've been having this discussion. It is not impossible, it is not difficult to diagnose a PID. It is only our lack of awareness which is prohibiting us from diagnosing these diseases. So once we suspect, it is not very difficult to diagnose PIDs, and we've been talking about the management options. So we have cure for many of these diseases. We, even if we don't have a cure for many of these diseases, we for some of those diseases where there is no cure, we can give them a good quality of life by giving the treatment options that are available with us. So that's a very important myth that exists in the community at present, and I
Mm-hmm.
think we should get rid of this myth as soon as possible. Amongst the parents or the patients, I think as I mentioned somewhere in the discussion, that always talk to your doctor, always try to seek help from your doctor whatever questions do you have. And I think as far as I know of the physicians who deal with PIDs, they are they always listen to you,
Mm-hmm.
always listen to your concerns, always try to sort out to the best of their ability. And rather than seeking advice from so-called quacks, it is best to seek help from an expert who can understand your concern and really take care of them. Some of these patients, uh, as we have seen, fall into practice of using alternative forms of medication, which may not be really useful for some of these diseases, and they end up having a lot of complications. So I think it's very important that they seek good help from a good physician who understand these diseases and who can really take care of their manifestations.
Right. So these are some of the myths which you just spoke about.
Mhm.
But we would like to know what are these facts or what are some of the facts that dispel these myths?
Right. Uh, so um, we started this discussion with the fact that considering our population, we are likely to have more than a million patient with PIDs.
Right.
Uh, so what we are actually seeing a tip of the iceberg. We haven't been able to diagnose, I think, 1 or 2% of them. So about 98% of patients with PIDs are still roaming in our country without receiving an appropriate diagnosis and without receiving an appropriate treatment. So this is
Probably they
something
don't even know that
they
they are.
don't even know that they have a
Yes.
PID, and this is putting them at risk of complications and, of course, risk of death as well. I think the most important myth, the most important fact is that these diseases are not being recognized in the country, and we have to put in efforts. From a parents or a patient side, they have to start looking for help. Start looking for an immunologist who can help them diagnose their PID. I think that is a most important fact that we all have to understand. uh, we also have to understand, diagnosis of PIDs is not very difficult at this point of time. We have the diagnostic facilities available in the country. We also have expert physicians who can understand these diseases very well and can take care of you know uh, take care of the diagnosis of these PIDs. We also have physicians who can treat these PIDs very well at this point of time in the country. So I think these are some of the facts that we should be aware of, and patients should seek appropriate help and in time.
Right.
Mhm.
So, Dr. Ankur, you were just mentioning earlier that probably only 1 or 2% is aware about what PID is, and 98% are not even aware on what PID, and let alone know the fact that they have PID.
Mhm.
So, what are some things that general public can do to create more awareness and be part of PID's research?
So I think this initiative is very, very important, wherein we are doing this podcast and trying to spread this awareness about PIDs across community. And we have been doing this for last many years,
Mm-hmm.
wherein we organize small CMEs, we organize awareness activity for patients as well, use social media, and I would also like to highlight over here, we have physician societies in the country for primary immunodeficiency diseases who organize CMEs to spread awareness about this disease amongst general healthcare physicians. Uh, I would also like to stress upon the patient societies which are available in the country.
Right.
There are at least two patient societies for primary immunodeficiency diseases in the country, and it is very important to for a patient with PID to be a part of these organizations and help spread awareness through use of social media, through organizing CMEs, and through various other means that we've been doing. Mhm.
Okay. So, by this, I'm sure many people would be more aware than the 1 or 2% population we were talking about on what PIDs are and how one can know that they have PID or their loved one have PID.
Mhm.
So, now that we are almost coming to the end of this podcast, what would you tell to our audience some general takeaways about PID?
So, I think we have already talked about many of these messages through this uh, very interactive discussion that we had. And I think the most important message is seek help. Whenever you feel that you are not keeping well, you are having infections which are more frequent than you should be having. We expect children to develop upper respiratory tract infections that come with cough coryza. I mean, that's usual, but something which is not usual, they are falling sick, they are requiring antibiotics to treat their infections, they are being hospitalized because of infections, because of pneumonia, because of diarrhea, because of ear infections, because of infections in their skin. So these are the time when you need to seek help from an expert who can understand these diseases and who can diagnose and manage them well in time. Uh, the most important message is that these diagnostic facilities, these management facilities are now available in the country. It's just that you have to start seeking help from an expert.
All right.
Mhm.
So, thank you so much, Dr. Ankur Jindal. That was really informative, and I'm sure at the end of this podcast, our viewers would have much better idea on what PID is and how they can identify if they or their loved one have PID, and what's the best way or the right direction to go about this. So, ladies and gentlemen, on all the viewers, I'm sure you all had a great time listening to Dr. Ankur over here. So, if you have any other queries, please do ensure that you reach out to us in the comment box, and we will definitely ensure we can answer your questions. So thank you so much. Have a wonderful day, everyone. Thank you so much, Dr. Ankul, for your wonderful time, and I hope you have a great day ahead.
Thank you so much. Thank you.
Thank you.